All right, everyone. Welcome back to Chai and Chat, presented by Taskeen Wellness, your go-to mental health podcast. I'm Zainab, and I'm joined by my wonderful co-host, Dr. Sarosh, as well as our very, very special guest today, Nosheen, a passionate advocate in the Thorncliffe and Flemington Park communities. We're so excited to have her here with us today. We're just going to dive into her work in the community, a little bit about Taskeen Wellness, and I'm going to pass it off to Dr. Sarosh to get us started.
Thank you, Zainab. Good morning, Nosheen. Welcome. Just wanted to ask you about your work in the community and what kind of projects are you involved in? I understand you're a very busy uh, person.
So I work at the TNO, the Neighbourhood Organization, as the food security coordinator at the TNO Food Collaborative, which is the food bank located in Thorncliffe Park, uh, and it is a part of the TNO. It is also an agency food bank for the Daily Bread Food Bank. So we are supported by Daily Bread Food Bank with our food inventory and our supplies, as well as them creating this space for us in our food bank, which is amazing. Um, and so, yeah, we support the community with food support. It is predominantly for Thorncliffe Park, but of course we support the Flemingdon community with TNO, the organization programming, and our hours of operation are longer than the food bank in Flemingdon Park. So we do have an overlap and have many food bank clients coming from Flemingdon Park, as well as sort of the catchment is, I'm a little bit more flexible with the catchment because we have, again, our hours are longer. So it's a bit of a fight with how we support our community. I feel like I don't want any barriers for the surrounding area with food support. So while we are supposed to only serve Thorncliffe, realistically with food banks, it doesn't end up being that way. We have trickling in from Haven, Cosburn, or Eglinton and Laird, and so yeah.
That's a common issue in many organizations, even in healthcare, right? Are catchment areas just a description? Are we supposed to hold tight to them, or can people be flexible? Because, when you say you serve all people, whoever comes, but then you have these restrictions.
Yes.
Be hard.
Yeah. I think with food bank, really, like, as long as we are reporting our numbers, our food supply is coming from Daily Bread Food Bank. And ultimately, I feel like we share a similar perspective, which is let's do the service, right? So rather than it being very black and white, and I don't think social service can be black and white. So I think that's one of our challenges all the time is that, my perspective is to be more open and, how do you create these boundaries, right? So I think it's better to be open and allow that. Some of our organization may not agree, but
I mean, working at the food bank, of course, you're dealing with really vulnerable people who are in a vulnerable moment in their lives.
yeah.
And that can be really impactful, and emotionally stressful as well. Has there been a moment that has been the most impactful for you? And what made it so memorable that it was so impactful?
I think when I first started, I didn't think I thought our community, my perspective of food bank when I started this job, living in Thorncliffe, being of Pakistani descent, I thought the food bank would actually be not very busy at all. I thought that our community would not reach out for this kind of help. Um, so it was surprising for me to see how busy we are, right? So um, it's been busy from the beginning and the numbers are only increasing. But I still think that our community, like for Pakistani community, is probably the smaller percentage of food bank use. And I remember a client coming in a single male from a newcomer from Pakistan. He came in and said, um, I just wanted to look around, like, and just see what's here. And I don't want anything. Maybe I'll donate. Like, he kind of didn't want to be very direct about him needing the food bank. And then he came again a few days later, and I was just like, I could feel that he really wanted food. Like, his questions were a little bit here and there about the food bank. And then I said, you can access the food bank. And he was like, oh, but, and then I had to like I supported him through getting to the point of being willing to register. Anyways, he started to cry. He got very vulnerable and started crying and said, you know, was I was very like successful in Pakistan. I had a good job. I worked with the government. He was like, I was very important, and I don't want to need help. It's very hard here, right? So I really felt for him because I understood that he needs help, but the challenge is not really just about the food, right? Like, from what I feel is that of course families are coming to get food, but food support is not the main issue, right? It's coming here and feeling hopeless and not feeling like there's enough resources. People come here with a lot of umid, right? Like, they think they're
Yeah.
going to come here and have everything. Canada's the land of opportunity, right? He did use the food bank. He was even more horrified that he was crying in front of me than even
Mm.
needing the food banks. But I just let him go through it. And now he doesn't use the food bank. So I still would see him around in the neighborhood. He felt like we had a connection. He cried in front of me. He was embarrassed about it. I didn't want him to feel embarrassed. I let him feel like it was okay. And then I saw him a while ago, and he's like, he remembers still, right? He said, I remember coming
Mm.
here and I don't need it anymore. I have a job. I'm
That's
doing well. And
such an amazing story. I think it's not only the loss of hope, but loss of status, right? I think you gave him something like you gave him permission to, it's okay. People can be vulnerable, and at different points, we all can be, and God forbid, in such a position.
yeah, of
And
course.
like, you saw him as a person. I think that's what stands out for me. You saw him as a real person and communicated with him like that. And that's why there's that connection, I guess.
Yeah, for sure. I mean, a lot of the families that come to access the food bank, you know, their react like just I feel like as a service provider, we should be making our families feel comfortable to come to a food bank, right? Like, and I think it's always a discussion about like, because the food bank is a free service, and some perspectives are that our families are taking advantage, or they don't need it, or they're just, using the system, like just all those perceptions versus the perception of feeling like they're here and it's no judgment, and use the food bank, right? Like, this is a service that if you need it, you should use it rather than it be, why do you need it, or determining who's worthy and who's not. Like, I think that is a huge part of, we have volunteers who have different perceptions or perspectives about food bank users, or and I always try to encourage our team to be open and not look at them like they're lying, or they might be trying to abuse it, because that is not what we should be doing. So I do find that as a challenge working with.
I think it's creating more stigma, because who wants to go and say, Look, I don't even have food to eat," right?
Well, yeah, absolutely. And our VP one day said it really well to our team, and she was saying, you know, anybody who's coming for charity, they need it. You're not likely to come in and ask for
Yeah.
charity. It's a big deal to ask for
There's so
help.
much that someone has to overcome to even make that step.
Yeah, exactly. So I think we really have to approach people as humans. So many of our community come in, and it's greeting them and acknowledging them and seeing them. It makes a huge difference to them. I always, on a daily basis, when clients are coming in, they know that I see them. They can feel it because part of my behavior. It's part of my
How-
personality to behave that way. And I see the gratitude in our clients because of that. And I think that is a huge part of the motivation of continuing to do what I'm doing, you know?
By seeing them as a person, you make it less shameful for them,
Yeah.
right? That they're worthy of taking part in this. And when they're on their feet, they can become like voices for people who need it and say, it's okay. You might need it now, and then things are going to be okay.
Yes.
So some of the work you're describing lends itself so nicely to the reason we all felt you and your friends felt you would be a great Taskeen wellness advocate, which is focused on starting mental health conversations, recognizing common mental health disorders in the community. So what has your experience been like being part of that community of practice of Taskeen and being an advocate? I know it hasn't been that long, but if you can comment on that.
I think that I feel like right now, and this is also very personal to me, right? So I feel like right now with mental health, it's very important and it's only growing, and I see it around me a lot, is the addiction part, right? So again, I think that in our community, we don't have enough addiction support. So that's something that I would love to see grow. And, more specifically, we have, and we have AA meetings at Thorncliffe Park, but we don't have NA resources. So to see some sort of increase in support. So I do see community members who need this kind of support. There's a lot more addictions in our community right now.
Anything that you can share a story about something like that, or what your opinion is about mental health in your community?
Yeah. So, I mean, I think that we do need NA. So I would like to see if there's like, I couldn't start an NA meeting. I don't have the, you know,
The
exposure to it.
Narcotics Anonymous.
Yeah, but I think we need it. So I actually, I've talked to some young people in this community who have said if there was NA in Thorncliffe, we would attend. So, and I've looked into it a little bit to start an NA meeting, you really just need two people. So it doesn't have to be like, and it's a volunteer thing, right? So two people
For
who
peer support model, chapters can be started
yeah,
by people. Yes.
yeah. So it would be good to have something like that. And I feel like it would be because so I know there's a lot of people around here who are going through addictions and don't feel like they wouldn't know how to navigate it. And they need and I know especially with addictions and recovery, part of the recovery is the accountability of attending a support group. So I would love to see that in the community. I would love to help make that happen if it's possible. But yeah, I talk to many people. The community is very comfortable speaking to me. So on a day to day, I speak to people and they talk to me about what's going on and they feel um, comfortable to share with me and I listen and I feel like that's very important in our community. It's very valuable to have the
So
ability to do
uh,
that.
having talking about starting NA, that's the kind of bridging that the scheme can provide, where we can help you link up and get you information, support you while you start that, just as a support for you to start. I think that's a brilliant idea to have that resource. And then, of course, you take it where you need to take it. But definitely, we can help with that. And I think with our next meeting coming up, we can discuss that, put that on the agenda, and have a fulsome discussion around that.
That would be amazing.
Because there is so much shame with substance use and addictions as well. There's a reason for why people end up being addicted to substances, because there's usually a mental health reason or a trauma. They've gone through a traumatic incident. But the main part of that becomes so shameful, and rejection, people reject such people.
Of
Right.
course. Yeah, absolutely.
Has there been a moment that's impacted you, as a teen wellness advocate, meaning for mental health support, that is memorable that you could share, that impacted you?
With mental health, we see a lot of people coming into our space that have, some barriers. I think that we still struggle with the stigma with mental health as well. And I interact with many people that are struggling. You know, maybe I just attract people to want to talk to me. So, which is great, really, I think. But
Prob-
um,
Probably seen as being approachable.
yeah, yeah. But I feel like as an organization, we are not ready for, like, we don't have the tools as colleagues and as staff to navigate it. So even with us in our food bank, for example, I have clients that come in and are frustrated. Or, there's a client right now that we're interacting with that has mental health issues. He's homeless. He's been staying around Thorncliffe and he will come in just for like apples and oranges. He's homeless. He says, I don't need to take a food bank load, right? He'll say, I just need to come every day and like get an apple or two. And so I've been letting him come. Like I'll acknowledge him coming as a once a week, and I don't even push him very hard to interrogate him for information. And so he's becoming somebody that's comfortable with me. Uh, and but it's very challenging for us again because sometimes he's like, I was sick one day and he came in and the volunteers were like, where's your ticket? And he was just like, what do you want? Like, he felt a little bit like he was being badgered or harassed about, checking in correctly. And he was just like, listen, I just came in to look around for a minute, and I think that they thought he was because he got a little bit agitated. And I tried to explain. It came up the next day when I heard that he came in and he was being like that. And the perspective of our team sometimes is, well, he shouldn't come because he's rude. And that's something that is a struggle, right? Because my perspective is that he is going through stuff and we have to be more understanding and patient. And our volunteers feel like I'm choosing the client over the volunteers. So that is something that is,
So I think that what you're describing, it's intimidating for people to have someone potential for maybe getting more aggressive or what have you. And what you're saying is there's a way to approach this situation.
right. And I try and explain this to our volunteers a lot, right? Because I'll say, you know, but it's very individual, right? Like I say, they think I'm very nice because I am, I'm less likely to, like, I kind of understand how to read the situation better, right? So this is what we learn is to be patient
Hmm.
and receptive, right?
Right. And yeah.
And our volunteers don't always understand that because they're on guard or they're more defensive, and then that creates the reaction, right, that they can't handle.
Yeah,
So,
I think the part of what you're describing exactly our own issues that we're dealing with often can come in the way if we haven't processed that. Like what you're saying, you're more aware of maybe in any given moment what you're going through. So to situate yourself more mindfully and say, okay, I'm present for this person because this is how I am and I can relate to them. Not everyone is aware about their issues like that, or they're
yeah,
at a different journey,
yeah,
ending. And so they're more defensive and they're just gonna meet the person how the person is rather than, have a stance of I'm gonna be calm and mindful about where I am and then receive this person.
yeah. Like we try, I always am trying to encourage our volunteers to understand that don't take it personal. It's not about us. When someone's coming in, especially with mental health issues, whether it be, like his situation has gotten to where he is now not following through on his own mental health treatment. So you're seeing the decline, right? And we don't need to be part of that additional stressor for him, right? By also becoming somebody who is responding to him in a negative way or looking at him in a negative way now, because it's only making his situation worse.
This is an example of using a case-based discussion, and we support you to actually do a workshop around that for the staff there to help them understand some of the reasons why addictions happen, how to talk, and still be safe, right? We're not saying put yourself in an unsafe situation, but how to recognize when it's okay to talk to a person like that and when it becomes unsafe, and when do we have to kind of bring in other people for support. It's a spectrum. It's not just one way is the right way.
Absolutely. I agree. We have through Daily Bread, we have verbal de-escalation, but they do a great job, but it is very broad, right? And it's not as relevant to our community and our community needs.
It's not
So,
really sensitive to your requirements.
right. They talk about good things. They talk about, people that are maybe because they look at it as obviously if we compare Thorncliffe to downtown Toronto, they're very different, right?
Yeah.
So it's a little bit harder to make the conversation specific to us, right? Like we need to
It's
customize it.
so diverse, right? In Thorncliffe Park, and challenges are. I mean, people are from another place. They bring that level of understanding or non-understanding of the situation that they're in, right? So all of that has to be honored. Like this person existed somewhere else, and now they're trying to exist in this space. With all the complexities of potential homelessness, food insecurity, and the shame that goes with it, the loss of hope. And, we hear all about, really bad outcomes where people ending up completing suicide, right? So really, really heart-wrenching stories. What attracts you to this kind of work, Nosheen, on a personal level?
I think that of course I understand how the need can be there, and I like to help people, of course. When I started the food bank, my mom was crying because they've gone through their own food bank experience, and she felt like, a lot of times when we have conversations, my mom is very much, uh, she's a very sensitive and open-minded person, and she's relatable, right? Since I started, she has always been like, she reflects back on when she came to a food bank the first time and she cried, and those conversations come where she, you know, tells me it was the first time she registered, and the person on the other side was very supportive and held her hand and walked her through it. Like similar to the story that I
It
shared.
makes a world of difference, right? The first experience defines everything in any organization.
It took them a long time to go to a food bank and not thinking that they should go in the first place. Because of course, same how I didn't think anyone would be coming to our food bank. She's Pakistani, didn't ever think she'd have to go to a food bank. This is the worst case scenario. So when she went and cried and felt better about being there, and the experience she had, my parents, when they would go together to the food bank, they even volunteered at Meals on Wheels later on in their life and felt like they were helping others, giving back. And so I feel like I know that a big part of why I'm the way I am is because of my parents. Like they're open and kind people.
They were first generation immigrants. They
Yeah,
immigrated.
50 years. And of course, back then, they did all the hard work of not needing to go to social services and, getting through it and reflecting how everything was expensive and $20 for something was a lot. And now everything is becoming easier to attain versus before. And so they went through it as far as they could. They worked as hard as they could. They owned a business for 20 years. It was when the business started to decline that they were like, now we are in a position where we can help ourselves. They never had, my mom didn't work very much to CPP and things like that. So they struggled and needing help was hard for them.
You grew up in this community as well?
I did, yes. I grew up in Thorncliffe Park and I grew up with all the different experiences of being a first generation Canadian and trying to adapt at a time when it was not as multicultural. We were assimilating more than we were being ourselves. Where now you see the difference of newcomers coming here and bringing their culture and keeping a lot of their culture, even though they, because it's changing, right? Like the way that it is in Canada now versus back then was you you did Christmas and you loved it, and now it's like you can opt out and you can be open about that and celebrate all your culture and not be ashamed or embarrassed or private about it. So we've come a long way in those ways for sure. I see a huge difference in how things are changing.
What do you think, my final question is what kind of other changes would you like to see for the mental health support, how it's addressed in the community?
I think that I think we need more groups of. I think we don't. I don't know if it's that we need to directly support mental health right away. Like I think what we need to do more is gather and share and develop a sense of belonging with other. Out of that, it may even solve some of the mental health indirectly, right? So
A
feeling
preventative approach rather,
right. Yeah.
because there are two parts to it. One is when someone's really sick, we've lost that opportunity. They need help
Yes.
now, but other people are not there yet, but they may end up there. Like,
Yes.
creating community.
Yes. I think that is very important. So even now, like for example, Eid is coming up, and if our community had more of an opportunity to celebrate Eid together in a space where they feel like it's a little bit more colorful like it was back home instead of it feeling like, okay, some people have each other now. Some are making the connections, but, some are feeling like I hear from many people how Eid is not the same in Canada because this is dry.
Like having spaces where you can come and be joyful and feel like you're part of a bigger whole and be part of a community in a visual way, you know.
Yes, yes, 100%. It would be, even if it's initiating it as community members and just bringing it together, finding more resources for space and, being able to
Mm.
make things like that happen. Like, of course, now it's going to start getting colder during Eid, and then you can't let's just have a picnic in the park. As like we need to find ways to use space in our community to do these things.
So what
Okay.
would you say to someone and living in the community who's struggling with their mental health? What would your advice be? And they don't want to maybe, there's some stigma is holding them back or uh,
I think if it's in the beginning, like I guess it would depend on what it is. So if it's, the beginning of depression, I would encourage them to get involved in things that make them feel good, like sort of work on the holistic
Mhm.
part of how to help them through it. So, for example, we have volunteers here, and we've seen changes in volunteers because of being involved in something. And at first, coming in and feeling isolated. I have a volunteer actually, for example, who was, a newcomer and stayed home always. And I actually met her because her son volunteered here and he ended up needing my help. So I met his family and she took a like, she was taken by me and felt like, okay, she wanted to start coming out. So she started to volunteer. My mom actually encouraged her to volunteer with us. And now has friends in the community. She's feeling confident. And like her family says, we brought her out. Like before that, she was very shy. She started doing English class and she's, her husband never thought she would learn English. And now she's starting to feel confident. Like, so that's a success story, I think. Like before that, she almost seemed like she was caged up at home. And that is something I think, she's not talking about her mental health, but it's, like you could see, like when I first met her, she was very excited that I came over and she had a visit. These are things that I think our community doesn't identify about themselves. They don't reflect on it anyways, right? They're not going to say, I'm feeling lonely and depressed and isolated. And so I think that we should encourage our community members to be involved in things and build themselves. And it will hopefully help with a lot of those barriers. But that's depression specifically, right? It's the beginning of feeling those ways. I think if they
But
have
you're really talking about recognition, right? And intuitively, some people have it intuitive way, which you are, and some people need to learn explicitly about how to start those conversations, how to pull that person along so they don't think you're doing it deliberately. It's done in a way that's very careful and not overt, right?
yes, I think if it was more extreme, sometimes the topic of getting I mean, we all know nobody wants to say that they need mental health. My friend, the homeless one right now, I said to him the other day that we have to connect you with a doctor and get you the support you need. And he was like, he said, he's mad at me right now because I said that to him, actually. So he said to me, anybody could end up in my situation and I'm mad at you. And you brought up something that I don't want to talk about. And on a global scale, it's going to happen to you. So we're trying to connect again because he was just like, you shouldn't have gone there. So it is a very sensitive topic. It's not easy to guide people to. And again, that was me being direct with him and saying, because actually one of our staff is trying to help him get through his ODSP application. I had to speak to his mom and she said to me, because I translated, so I spoke to his mom and she said to me, he's not getting the help he needs. He's not following through on his medication and that's why he's on the street now. So I think it's not an easy topic. I think it's
No,
not easy to guide someone with their mental health
it's so much
directly.
to have the ability to guide the family members and,
Yeah.
and understand the background and understand the cultural aspect and how shameful it is to talk about mental health or admit or just never admit it. That's not even on people's horizon.
We have some other clients that come around our space who are agitated. I don't think as an organization we are equipped to
Mhm.
handle it, right? Like because I do see the reaction a lot of times with mental health is that this person is too much for us, like can't come in our space. Where I feel like that shouldn't be our reaction, right? Like I don't think our response should. So again, it comes back to the same thing. Like, our response shouldn't be he's unsafe for us. It should be how do we navigate clients? And again, like you were saying, like us feeling safe, but supporting, right? So that is, I think, something that not everybody doesn't have these skills, right? And we are not required to have these skills with
Yeah,
a lot of
and
our
people,
jobs.
right? So what you're identifying is a very, very important part that we can have a conversation offline and support you through that. Because I think the staff, if they became comfortable, well, how much better would it be for the people accessing the food bank? Problems also stigmatizing, but then people stigmatize you even more, and then you become isolated, and then you become homeless, and then,
That's what it is, we have some incidents recently, like not directly with the food bank, but I'm seeing around me and they make me feel for the family or for the whole family and that person that they're spiraling and I think it's irresponsible of us to allow that to happen. right? So I think that we need to support our
It's
colleagues.
injury to see someone just deteriorate right in front of your eyes and not either want to help them or feel like you can help them or wanting to help but can't.
Or justifying our reaction rather than empathizing their
Yeah.
situation, right? So I think that's challenging.
Thing when I hear a person's story, it brings compassion. Even if the person in front of you is a certain way, but once I find out a bit more about them, they become a person and they're like, wow, they've been through that. And then that brings compassion and understanding.
Yeah,
But people have to be able to get to that point of finding out about that person.
absolutely. And I think that goes back to the same thing that nothing is black and white, right? So we looking at the grays shouldn't mean that we are now convoluted in our thinking. It should be that we are trying to support and navigate somebody through their struggle. I feel like we have to be more supportive and understanding. And I think that's a struggle for sure for a lot of people. They don't want to hear those things. They just want to say that the person is wrong or they're right. And I think we see that a lot around us.
Well, they're either utilizing black and white thinking themselves.
Right. Which is not progressive, right? Like, so
I think this is a good place to stop and let you go. I know you're busy, but thank you for such a such generosity of sharing these stories. Is there any last comments that you want to make before we end?
no, just thank you so much for giving me the opportunity to speak and
Well,
yeah,
thank you for having us talk to you because it's really inspiring the work you're doing. It's brave and courageous work. It's not everybody that can do that and have that much understanding and compassion. It takes a lot. Really inspired. Thank you.
Thank you so much. And thank you, everybody, for watching. Thank you, everyone, for joining us on this episode of Chai and Chat. If you're interested in becoming a wellness advocate with Taskeen Wellness like Nosheen, you can visit our website, taskeenwellness.org, or our Instagram, Taskeen Wellness, to learn more. See you next time.